Okay, students, here we are going to talk about baby sleep. This is something for all of you that plan on having children that you need to think through before baby comes. How are you going to get this little one to sleep? Don't make the mistake in assuming that they sleep willingly and easily, because not all of them do that. So the first question that you need to ask yourself as an expectant parent is, where's baby going to sleep? Many parents do choose to have their infant sleep in a crib, often in a crib that is in another room. Some parents, particularly parents that are nursing, choose a bassinet that is right next to the bed. And some parents do choose to co-sleep. Now, I do want to be clear that co-sleeping, while supported by attachment theorists, is not recommended by APA, and it is not recommended by hospitals and physicians for reasons that we're going to talk about in some detail. In terms of sleep theory, there are three major theorists that have worked on sleep. We're going to talk in detail about Weisbluth. I'm going to give you a little bit more information in detail about how he approaches sleep and sleep issues with infants, and do some comparing and contrasting his theory with Ferber. For those of you that are interested in pediatrics, most pediatricians recommend the Ferber approach to doing sleep training with infants. The last approach is Dr. Sears. Dr. Sears takes an attachment theory approach to sleep training. In fact, he would never even call it sleep training because what he supports is meeting the child where they're at and co-sleeping, essentially encouraging co-sleeping with infants. So when they're first born, they sleep a lot. When they're newborns, they sleep a lot. They sleep about 17 hours a day, and they usually do it in 1 to 3 hour segments. So they're doing a lot of sleep. We call it active sleep. What Weisbluth found in his research, and this is his specialty, he's a pediatric neurologist and has done his research on pediatric sleep, and he finds that when they are newborns, particularly when they are under 3 months old, they do what he calls a lot of active sleeping. They doze, essentially just dozing. They're able to wake up very easily. They go back to sleep very easily. They're not really deeply sleeping. Deep sleeping is much more quiet sleep, very slow brain waves, slow breathing. They're in a very, very deep, deep sleep. They have a very high proportion of REM, which is rapid eye movement. Anybody's ever seen a newborn sleep, you'll see that they jerk, their eyes flicker, and they're just experiencing very rapid brain waves. A little trick here, sometimes new moms, when their newborns are sleeping, they kind of panic, and they're like, wow, are they really breathing? One thing to do is to just touch their nose. Take your finger, just rub it along their nose, along the tip of their nose. They will lift their hand. It's an instinct. They'll lift their hand to get you away from their nose. So as I said before, during the first 3 months, what you're going to get is you're going to get some very shallow sleep out of newborns. In the first 3 months, very, very little can be done in terms of sleep training. Essentially, set a routine. You're doing the same things in the same order every day. They really like it. Babies like a routine. Set their circadian rhythm. You don't need to take them outside a lot, but take them out early in the morning. When I say early, I'm talking about before 9 o'clock. You're going to be amazed because newborns like to wake up early. They don't need to spend a lot of time out there. Just put them in their carriage or sit them outside with you, 10, 15 minutes, just so they get the sense that it's daylight. And then early evening, take them outside as the sun is starting to go down, 10, 15 minutes, so they get the sense, oh, now nighttime is coming. You have to kind of understand that they've spent 9 months in complete darkness. Then they're born, and their time in the hospital is almost continuously infused with light. So when you get them home, you have to kind of set their clocks, get them to understand when is day and when is night. Practice swaddling, particularly when they're under 3 months. Really, once they get past 3 months, it doesn't really work quite as well. Swaddling is essentially taking a special blanket and you're just kind of wrapping them up nice and tight and secure. Not too tight, but you want them to feel packed in. They really like it. Oddly enough, they really like it, and once they get swaddled, they bump and they fall asleep. And then try to find some techniques that you know are going to work long term to get that baby to fall asleep. Some babies like to be walked. Some babies like to be driven in the car. Some babies like to be sit in their vibrating chair. Some babies like to be sung to. You want to cultivate a couple techniques that you're going to be able to turn to in order to help them to get to fall asleep when they get 5 months, 10 months, 12 months, and you might start to have some sleep issues with them. And as I said before, the other big thing to do during this time is to pick a place where you want them to sleep. By 3-4 months, quiet sleep starts to increase and periods of alertness start to begin to emerge. Now, one of the things that Weisbluth finds in his research is that about 10% of babies are very easy. They sleep anywhere for any length of time. They fall asleep easily. They stay asleep for a long period of time. At 3 or 4 months, you're going to start to get some naps emerging right around 4 months old. They fall asleep, they'll sleep for 2-3 hours. Some babies are high fussy. In other words, they may be colicky. You'll see this in colicky babies. You'll see this sometimes in preemie babies. They don't like to sleep. It's hard for them to fall asleep. It's hard for them to stay asleep. They're not natural nappers. They are short nappers. And by short, I mean 30 minutes. They cry easily. And Weisbluth says they're very fussy, and there's very, very little that you can do in terms of sleep training a high fussy baby. But most babies he calls normal fussy. About 80% of babies are normal fussy. So in other words, utilizing some techniques and some strategies can help you kind of get into a routine and help them learn how to be good sleepers. All right, so early on in the lecture I talked about not co-sleeping with your child. In 1990, about 5,000 infants had died of sudden infant death syndrome, or SIDS, in the United States. And a campaign was started that was called Back to Sleep. In other words, instructing new parents on having their infants sleep on their back. And what they found is that back sleep significantly reduces the risk of SIDS. In terms of what causes SIDS, we really don't know. We often find this in infants that had low birth weight, if they're put to bed with heavy clothing, too much bedding that's too soft, teen parenthood, maternal smoking. These are all factors that can weigh in or might be indicators of a higher or increased likelihood of SIDS. Another one is formula-fed babies. One of the things that we know is that infants that are breastfed, they have a reduced risk of SIDS. So what research has told us, has indicated to us, is that to reduce the risk of SIDS, you need to go put your infant on their back in order to sleep. Some of the other suggestions include bassinet sleeping next to caregivers, at least until about 9 months old. One of the things that research finds is that after 9 months, the risk of SIDS decreases very, very sharply. Because usually baby's big, and baby can sit up, roll around, physically a lot stronger. And what the bassinet next to the caregiver does is research has found that mothers intuitively listen to their babies when they're sleeping. And if they think that there's a problem, they wake up right away and they check. Breastfeed, breastfeed, breastfeed. This is a significant reducer in SIDS. Don't overdress baby for bed. I know that those caps are really cute. I got them for my daughter. I love them. No caps, no blankets, just some PJs. Put them on their backs and put them to sleep. No co-sleeping. Hospitals now make parents sign a release form promising that they will not co-sleep. This is in fact quite dangerous. I know of, I have a friend of mine, her husband actually was co-sleeping with their daughter during nap time, and he rolled over on her and suffocated her. it was a tragedy. It was a tragedy, and it was a complete accident. And to me, the convenience of it does not outweigh the risk. And interestingly, use a pacifier. One of the things that they find is that little ones that suck on a pacifier also have a reduced risk of SIDS. Okay, so when should sleep training start? Weisbluth he encourages parents to start sleep training between 4 and 6 months. What he says here is that at this point, if you have been co-sleeping and you choose to not continue it, this is the time to move baby. Do not wait after 6 months. I'm going to be really honest with you. They like to co-sleep. They like to sleep near you. They like to sleep on you. But if you don't move them right around the 4-month, 5-month mark, you need to commit yourself to co-sleeping until they are at least 2 years old, maybe even 3 or older, because they become used to you helping them fall asleep, and they're not going to willingly give you up. So that's the first step, is between 4 and 6 months, you really need to get them sleeping on their own, either in a bassinet or in a crib. By 12 months, most children have 2 naps, and they sleep through the night. Usually a morning nap, about, Weisbluth says, about 2 to 3 hours after baby wakes up, 9:30, and then an afternoon nap, again, 2 or 3 hours after they wake up from their nap, 2:30, right around there. Now, how do you get them to fall asleep? So there's 3 things to think about when you're sleep training: falling asleep, staying asleep, and scheduled sleep. Falling asleep. Ferber says they look drowsy, put them in the crib, put them in the bassinet. He does not want you to put them down asleep. Now, Weisbluth says for nursing moms, that is nearly impossible, because for those of us who have nursed, or those of us that want to nurse, I'm going to tell you that the nursing puts them to sleep. And Weisbluth says it doesn't really matter. If they've fallen asleep, then put them to bed asleep. If you're not nursing, then put them to bed drowsy. Staying asleep. All right, so you've put them down, they're in their crib, they're in their bassinet, and they wake up. How do you respond? Well, Ferber says go in at timed intervals. And what you're going to do is 3 minutes late, let them go for maybe 3 minutes, 4 minutes. You're going to go in for a minute, get them to calm down. You'll walk out. You're going to increase the time. 6 minutes, 7 minutes. You'll go back in, get them to calm down. You walk out. You're going to wait. And what you're going to do is you're going to keep increasing the time intervals until they fall asleep on their own. It's basically what Weisbluth says. It's a form of cry it out. What you're really doing is you're forcing them to learn how to put themselves to sleep. Weisbluth would argue that you have them cry it out until they fall asleep. Now, a lot of people that have used cry it out, generally what happens is you put them down, let's say around, let's just say 8 o'clock for the sake of conversation, and they wake up at 10 or 10:30. You do not go in and pick them up. You let them cry. And usually the first time that they'll do this, they might cry for 30 minutes. They'll go back to sleep. The next time they wake up, instead of crying for 30 minutes, they might cry for 20. And what will happen is the duration will get shorter and shorter, and after maybe 2, 3, 4 nights, they're done. They've learned that you're not going to come, that they need to put themselves to sleep, and that they will do so. Now, the only caveat that Weisbluth has here is that if you have a high fussy baby, this is not going to work. With that 10% of babies, they will persistently cry and cry and cry and cry, and they'll cry for well over an hour, and they will not give it up. Attachment theory, Dr. Sears, he says you pick them up and you put them back down. You pick them up so that they stop crying, you rock them, you get them sleepy again, you put them back down. Or you follow the 20-minute rule. You hold them for about 20 minutes until they're asleep. And you know they're asleep because they've got that kind of dead weight. And then you go ahead and you put them back in their crib, or you put them back in their bassinet, or you just simply co-sleep with them. Now, the next section is scheduled sleep. And what Weisbluth says is that naps should be about 2 to 3 hours after baby wakes up in the morning. Or if The baby's very, in terms of variable, in terms of when they wake up, just pick a time. Say sometime between 9 and 10, and then an afternoon nap sometime between 2 and 3. Weisbach says that in terms of how long they sleep for a nap, it's pretty genetic. There are short nappers and there are long nappers. And he finds that short nappers usually sleep right around an hour. Long nappers, they can not unusual for them to even put in 3 hours. Bedtime should be between 6 and 8 in the evening, and they should wake up between 6 and 8 in the morning. And this is the schedule that you should follow. He really believes they should be doing quite a bit of sleep. It's very, very challenging because as they get older, they get stronger and they get more persistent. So the longer that you wait to do this, the harder it becomes in order to get them to sleep on their own and get them to sleep through the night. Because they come to understand that you don't like to hear them cry. And they know that you will eventually go back in there. And it is hard. It's hard as a parent to do this. To be able to let them cry and fall asleep on their own. It's very, very challenging.